Most men who sit across from me are not worried about their heart, their blood sugar, or even their prostate. They lean in quietly and ask something else, something they have carried alone for years. They ask me if what they are doing in private is slowly harming them. My name is Dr. Daniel Hartman. I am 68 years old, and I have been a practicing urologist for more than 4 decades. I am also a man who has grown older in his own body, who has watched his own desires change, his own erections change, and his own understanding of masculinity change. What I am about to share with you is not theory. It is a lifetime of listening, examining, studying, and living. When we talk about masturbation after 60, most conversations either turn into jokes or fall into silence. Neither helps. The truth is that sexual expression does not disappear with age. It evolves, and if it is misunderstood, forced, or neglected, it can quietly create problems that many older men assume are simply part of getting old. The first mistake I see is not the act itself, but the attitude toward it. Many older men approach masturbation with the same expectations they had at 25 or 35. They expect the same speed of arousal, the same rigidity, the same frequency, the same recovery time. When their body does not respond in the same way, they push harder. They grip tighter. They stimulate more aggressively. They try to force an erection that now requires patience rather than pressure. At 60 and beyond, the penile tissue changes. Blood vessels lose some elasticity. Nitric oxide production decreases. The smooth muscle inside the penis does not relax as easily as it once did. Erections are still possible, often very satisfying, but they are more dependent on adequate stimulation, emotional state, cardiovascular health, and time. When a man responds to slower arousal by increasing friction and force, he can cause micro-trauma to the skin and deeper tissues. Over time, this can contribute to pain, curvature, hypersensitivity, or the opposite problem, reduced sensitivity. I have seen men develop persistent soreness because they were trying to train their penis back to its younger state. The penis is not a machine you can whip into performance. It is vascular tissue that requires circulation, oxygenation, and gentle responsiveness. Aggressive handling may not cause immediate damage, but repeated strain over months or years can create inflammation that becomes chronic. Another silent mistake is ignoring lubrication. Younger men often rely on natural lubrication from arousal, and in youth the skin is more resilient. With age, skin thins. Moisture retention decreases. Friction that once felt neutral can now create irritation, small tears, or inflammation of the glands. Some men are embarrassed to use lubricant, as though it signals weakness. In reality, it signals wisdom. Proper lubrication reduces friction, protects tissue, and allows stimulation to remain pleasurable rather than abrasive. There is also the issue of frequency. I am often asked how often is too often. The answer is not a number. It is about recovery and comfort. At 20, a man might masturbate daily without noticeable strain. At 65 or 75, the refractory period can extend significantly. The body may need more time to restore blood flow balance, hormonal equilibrium, and tissue sensitivity. When men ignore this and attempt to maintain a youthful frequency without regard for recovery, they may notice increased fatigue, pelvic discomfort, or difficulty achieving erection the next time. The pelvic floor plays a much larger role than most older men realize. These muscles support bladder control, bowel function, and sexual response. During orgasm, the pelvic floor contracts rhythmically. Over decades, especially in men who have had prostate surgery or chronic straining from constipation, these muscles can weaken or become dysfunctional. Excessive or tense masturbation without relaxation can exacerbate pelvic floor tightness, leading to pain in the perineum, discomfort after ejaculation, or even urinary symptoms. I have treated men who believed they had a prostate infection because they felt pressure or aching after climax. Often the issue was muscular tension combined with repetitive stimulation without adequate relaxation. Learning to breathe deeply, to allow arousal to build gradually rather than forcefully, and to consciously relax the pelvic floor during and after stimulation can significantly reduce these symptoms. Another mistake that harms men quietly is relying exclusively on visual stimulation that is highly intense. I will speak carefully here because this is not about moral judgment. It is about neurobiology. The aging brain remains plastic, but dopamine pathways adapt to patterns of stimulation. If a man conditions his arousal exclusively to highly stimulating, fast-paced visual content, he may find real-life touch, fantasy, or partnered intimacy less responsive. This can create a cycle where stronger stimulation is required to achieve the same effect. In my clinic, I see men in their late 60s who say, "Doctor, I can only get hard alone, not with my partner." Often, the issue is not testosterone. It is conditioning. The brain has learned a very specific pathway to arousal. After 60, when natural arousal is already slower, narrowing that pathway further makes erection even more dependent on a particular stimulus. Expanding arousal back to touch, imagination, emotional connection, and slower sensory engagement can help restore balance. There is also a psychological layer that cannot be ignored. Many men over 60 grew up in environments where sexuality was rarely discussed openly. Masturbation was often framed as shameful or dirty. That shame does not disappear with age. It goes underground. When a man carries unresolved guilt into his private life, his body responds with tension. Tension interferes with erection. It interferes with orgasm. It interferes with relaxation after climax. Chronic stress elevates cortisol. Elevated cortisol suppresses testosterone and impairs nitric oxide function, which is crucial for erections. When masturbation is accompanied by anxiety about being caught, fear of moral failure, or self-criticism, the physiological environment becomes less supportive of healthy sexual function. Addressing this is not about changing beliefs overnight. It is about recognizing that self-compassion has a direct biological impact. Prostate health is another area of confusion. Some older men believe that frequent ejaculation will prevent all prostate problems. Others fear that masturbation will cause enlargement or cancer. The truth lies between extremes. Regular ejaculation may contribute to prostate fluid turnover, which can be beneficial. However, masturbation that is forceful, prolonged, or accompanied by chronic inflammation can irritate the prostate and surrounding tissues. If a man experiences burning with urination after ejaculation, blood in semen, persistent pelvic pain, or difficulty emptying the bladder, that is not something to ignore. It is not just age. It warrants evaluation. The mistake is assuming silence equals safety. Many older men endure symptoms quietly because they feel embarrassed to bring them up. As a physician, I can tell you that we have heard it all. Nothing you say will shock us. What concerns us is untreated suffering. Medications add another layer. Many men over 60 take drugs for blood pressure, depression, or prostate enlargement. Some of these medications affect libido, erection firmness, and ejaculation. In response, men may increase stimulation intensity in an attempt to overcome reduced sensitivity. This can create a cycle of frustration and more aggressive handling. Sometimes the solution is not more effort, but a medication review. Cardiovascular health is inseparable from sexual health. An erection is essentially a vascular event. If arteries are narrowed from atherosclerosis, blood flow is reduced. Masturbation that results in incomplete erections is not necessarily harmful in itself, but persistent difficulty achieving adequate rigidity can be an early sign of cardiovascular disease. Ignoring that sign and focusing only on technique misses the broader picture. Hydration, sleep, exercise, and metabolic health all influence erectile function. I often encourage my older patients to see masturbation not as a test of masculinity, but as a barometer of vascular well-being. If you notice a significant change in erection quality, do not only adjust your hand, consider your heart. There is also the matter of delayed ejaculation. As men age, nerve sensitivity can decrease. Some men find they need longer and more intense stimulation to climax. In response, they may grip very tightly or use repetitive, high-friction techniques that no partner could realistically replicate. Over time, this can create a pattern sometimes referred to as idiosyncratic masturbation, where the body responds only to a specific type of stimulation. This is not irreversible, but it requires patience to retrain. Slowing down, using a lighter touch, allowing arousal to build gradually, sometimes abstaining for a short period to reset sensitivity. The mistake is doubling down on intensity and wondering why partnered intimacy becomes more difficult. Men who have undergone prostate surgery face unique challenges. Nerve pathways may be altered. Erections may be weaker or absent for a period of time. In these cases, gentle stimulation can be part of penile rehabilitation, promoting blood flow and tissue health. However, forcing erections before the body is ready can cause discouragement and discomfort. After surgery, guidance from a urologist is essential. What helps one man may harm another depending on surgical details. I also want to speak about pain. Pain is not normal. Occasional mild soreness after prolonged activity can occur, but persistent pain during erection, curvature that develops gradually, or plaques felt under the skin may indicate conditions such as Peyronie's disease. Repetitive microtrauma from aggressive masturbation can contribute to scar tissue formation. Early evaluation allows for more effective treatment. There is a subtle but important distinction between healthy sexual expression and compulsive behavior. Retirement, loneliness, grief, and boredom can increase the urge to seek comfort through sexual stimulation. Masturbation itself is not harmful, but when it becomes the primary coping mechanism for emotional distress, the underlying issues remain unaddressed. Emotional isolation can manifest as increased sexual preoccupation. Recognizing this is not about self-judgment. It is about asking what else you might need. Intimacy is not limited to penetration or orgasm. Touching your own body with awareness, without rushing toward climax, can maintain nerve pathways and blood flow without strain. Many older men have never been taught that arousal can be explored slowly, without a performance goal. Removing the pressure to achieve a certain erection or orgasm intensity often improves both. Hormonal changes deserve attention as well. Testosterone gradually declines with age. Low levels can reduce libido, energy, and erectile quality. Some men respond by increasing stimulation in an attempt to compensate for reduced desire. If you notice decreased morning erections, persistent fatigue, low mood, and diminished sexual interest, a simple blood test can provide clarity. Hormone replacement is not appropriate for everyone, but evaluation is reasonable. Sleep apnea is another silent contributor. Poor oxygenation during sleep affects testosterone and vascular health. I have seen men chase erectile solutions for years without addressing untreated sleep apnea. Once treated, sexual function often improves. The mistake was assuming the problem existed only below the waist. Let me speak now from a more personal place. As I aged, I noticed my own arousal required more patience. At first, I felt a quiet frustration. I had spent decades counseling men about normal changes. Yet when my own body shifted, I had to confront my pride. It was humbling. I learned to slow down, to allow sensation to unfold rather than demanding it appear on command. That shift did not diminish my masculinity. It deepened my understanding of it. Masculinity after 60 is not measured by frequency or rigidity. It is measured by awareness, by adaptability, by respect for one's own physiology. The body is not failing. It is transitioning. When you align your expectations with biological reality, frustration decreases and satisfaction often increases. Another mistake I encounter is neglecting overall penile health. Gentle stretching during erection, maintaining good hygiene, avoiding harsh soaps, and monitoring for changes in color, texture, or curvature are simple practices that protect long-term function. Diabetic men in particular must be attentive, as elevated blood sugar impairs nerve function and increases infection risk. Urinary symptoms sometimes overlap with sexual concerns. If masturbation is followed by significant urinary urgency, weak stream, or dribbling, an enlarged prostate may be contributing. Treating the prostate condition often improves post-ejaculatory discomfort. Again, silence delays solutions. There is also the relational dimension. Some men in long-term partnerships stop communicating about sexual needs as they age. They assume their partner is no longer interested or they fear rejection. Masturbation becomes a private substitute rather than a complement to shared intimacy. Over time, this can create emotional distance. A quiet conversation can reopen doors that both partners assumed were closed. Widowed or single men face different realities. Loneliness can intensify sexual longing, but it can also make orgasm feel bittersweet. I have spoken with men who feel an unexpected sadness after climax, a reminder of absence. This is not a medical disorder. It is human grief surfacing in vulnerable moments. Allowing that feeling rather than suppressing it can be healing. If there is one theme I hope you hear, it is this. The harm rarely comes from masturbation itself. It comes from force, from shame, from ignoring signals, from isolating the act from the rest of your health. Your penis is not separate from your heart, your brain, your emotions, or your relationships. It is integrated into all of them. When something changes, be curious rather than critical. If erections are weaker, ask what your body is communicating. If sensitivity is reduced, explore gentler stimulation rather than harsher. If desire fluctuates, consider sleep, stress, medications, and hormones. If pain appears, seek evaluation early. After 60, sexual health becomes less about conquest and more about stewardship. You are caring for tissue that has served you for decades. You are supporting blood vessels that reflect your cardiovascular status. You are engaging nerve pathways that benefit from mindful use, not abuse. I often tell my patients that aging does not close the chapter on sexuality. It invites you to read it differently. There can be more tenderness, more awareness, more connection to your own body. There can be less urgency and more depth. But this requires letting go of the idea that you must perform as you once did. If you are listening to me now and wondering whether you have already caused damage, know that the body has remarkable capacity to recover when treated with respect. Reducing intensity, allowing recovery time, improving cardiovascular health, addressing hormonal or medication factors, and releasing shame can lead to meaningful improvement even in later decades. Speak to your doctor. Speak honestly. We cannot help with what we do not know. You deserve clarity, not confusion. You deserve comfort, not quiet suffering. I am 68 years old and I continue to learn from my patients and from my own body. What I have learned is that sexuality in later life is not about proving vitality. It is about honoring it. When you approach your body with patience instead of pressure, with curiosity instead of criticism, you protect not only your erections, but your dignity. And that, in my experience, is what truly sustains a man as he grows older.